Thank you everybody for attending. I'm here to talk briefly about the updates to the New York Healthcare Worker Bonus Program. This came out August 3rd. There's been some confusion surrounding it, and so the state's been holding weekly webinars for updating their FAQs, and so here is our interpretation of these FAQ updates. First and foremost, I'd like to talk about the correction to employee eligibility clarification, and this is broken down into 4 parts in order to be eligible. And you have to meet all 4 of these parts for eligibility. Part 4 was broken down into multiple factors. Initially, employers had to meet this part. Now employers just meet one of these 4 factors for Part 4 to be eligible. Importantly, Part 4 now contains a provision that employers serving a 20% Medicaid population is going to be eligible to receive this healthcare worker bonus payment. So now it's the 4-factor test meeting all 4 parts, but Part 4 has 3 parts, just have to meet one of those parts. Moving on, the state also clarified that contract employees are going to be eligible for this healthcare worker bonus, in that the employing agency is not responsible for paying this bonus. It's actually the facility or hospital, et cetera, where the contracted employee is providing the services, that is responsible for providing the payment. So the facility that they're going to work in is considered the qualified employer for purposes of this bonus, and they are obligated to make that payment. The state also clarified how this bonus applies to former employees. This comes down to a few factors in the analysis. So you have to consider whether the employee left on their own volition or were they terminated, when the employee left, and when the employer applied for or made this claim for the healthcare worker bonus. So if you're an employee who was vested, was employed at the time of the claim, and stayed with the employer for at least 30 days after the employer received the bonus payment, the employer fails to pay the bonus within that 30-day receipt, the employee leaves, the employee still is going to receive the payment. Similarly, if the employee vested and before the employer submits a claim, the employee is terminated by the employee is going to be eligible for that payment. So long as the employee was employed during the vesting period, if they were terminated sometime after that vesting period, they're going to receive the payment. On the flip side of that, if the employee left on their own, if they leave before the 30-day period after the employee makes the claim for payment, they're not going to receive the payment. So there's that distinction between termination and employee leaving on their own. That's really important for the analysis. The state has also announced that there's going to be a grace period for submission. So we know that the first deadline is coming up. It's coming upon us this Friday, September 2nd. That's a pretty quick turnaround from when the program was dropped. So the state has acknowledged this and said employers that make a good faith effort to meet that deadline, even if they don't meet it, they can apply in the second vesting period. And that vesting period is from October 1st to October 31st. The portal is going to be closed between September 2nd and October 1st. So there's no submissions that can even be made in that time. But so long as you make a good faith effort to meet that first vesting period, you are good to go for the second vesting period as an employer. And finally, with enforcement, if you as an employer applied for the bonus for an employee that's not qualified, turns out, and you're audited, turns out you paid it out to an employee that's not qualified, you as the employer have to pay it back to the state. It's not the obligation of the employee to pay it back, the employer has to pay it back. Flip side of that, if the employer receives a healthcare worker bonus payment and fails to pay it out to the employee, then the employer is going to be subject to penalties and fines from OMIG and still have to pay out to the employee. And the ultimate repercussion for failing to abide by this overall program is that you could be excluded from the Medicaid program. So it's really important to abide by these requirements to maintain your Medicaid eligibility.